I know how to sew. And when news reports started to say that was a shortage of masks, that was something that I was capable of doing. I mean, I ordinarily make wedding gowns, so this is considerably simpler than that.
I can't be a doctor. I can't deliver mail. I don't work in a grocery store. I'm 9 to 5 doing my pencil pushing type job. But here's how I can make a difference.
They've come out now recommending that we wear a cloth mask as lay people to, keep the medical masks for healthcare workers. And so I love to sew, and I thought, well, I found a great pattern on Pinterest, and I thought, what a good way to kind of put my hobby to benefit.
After being depressed and sad for a couple of days, I decided that was the best thing to do, was offer to do that for people, anybody who wanted it. Mostly CNAs, RNs, are contacting me, a couple of home health care services. So I just started organizing because I was so mad that it was necessary. So I put it out on my listserv that I would be sewing masks, and I was looking for other stitchers to join me. There are tons of free patterns out there. And the first one I saw made a lot of sense to me. It was from the Deaconess Hospital in Georgia, I think. The hospital put out a request saying, this is the pattern that would be very useful to us. Please, please make us masks. And in a few days, they had thousands upon thousands upon thousands of masks. So they said, okay, stop. Don't make us masks anymore. But here's the pattern and do with what you will.
I first got the idea when I saw it on the neighborhood listserv, and I thought that that's something I can do to help. Also, I used to be a nurse at Duke, so it's very close to me what they're dealing with.
Went into the office, and I was concerned about that because in our area, there were people coming up with COVID. So I started looking around at masks online, and I was like, okay, find this one. Then all of a sudden there was a burst of patterns. So I went through all the patterns, and then I found the two that I liked the best, and that's what I've been rolling with ever since. And they came out of Missouri Star Quilt Company, Jenny Doan.
First, I started making masks for my family. And then I decided to reach out and see who else needed assistance.
Like a really small thing that I feel like I can do in a time when I feel really like impotent, and just kind of like powerless to do anything. So this gives me something to do. These are all the masks that I made today, and amounts to about 20, counting the ones that I made for family, and I hope to make at least 80 more.
Initially, I made it for my family and friends, and I have a friend who's in a nursing facility. He'll be 101 on Monday. And I was talking to this administrative staff person on the floor, and she said, yeah, we have some masks. I'm like, okay, you can tell me straight up. Do you really have masks, or do you need some? She says, well, Miss White. I said, okay, fine. Tell me how many on a shift, and I'll make some for you all. So I made some for that shift, for his floor, and I'm waiting to see if they want some more, because my thing is I want them to be in good shape to take care of my person and to take care of all the rest of the folks in the facility.
Part of the reason that you want to do this is because everyone feels such a loss of control over every single aspect of their lives. And everyone wants to do something that contributes to public health and the greater good. And this seems to be what is, for me, a relatively simple way of doing that. It's, as much for one's own mental health as it is for public health.
I contacted one of my quilting sisters from the African American Quilt Circle. They had changed her ward at the VA hospital to be a COVID-19. So they were scrambling for ways to protect themselves. My masks weren't needed. So my mask went to a nonprofit organization that she knew of that she wasn't able to cover because she was helping herself and her coworkers with masks. When she said she was working at the VA, I don't know if she realized how many people would step up to help her.
I have been trying to keep up with my patients since we've been out of the office, and I sent a newsletter just mentioning that I was using my sewing skills to make these masks, just to inform patients how I'm keeping from being bored. And I've had a huge response and a lot of requests for masks.
If you have something that looks like it's homemade, that's in a colorful, fabric, or it looks whimsical, then it's very clear that you haven't stolen masks that healthcare workers should be wearing. So I think it's very important that these things do look kind of crafty, if you will, to show anyone who sees you with them knows that their efficacy is only as good as a home sewer can do.
I got in touch with a friend of a friend who's collecting these masks, and there's a whole network now that I'm getting emails about these masks all the time. And a couple days ago, she wrote, "I've gotten a request for 40 more. Does anybody have any ready?" So I decided to crank it up last night, and I had cut a lot of fabric already. I have a lot cut that I haven't made yet. See.
You're going to be wearing the mask for a long period of time. I find that having something around your ear, like most of the mask patterns that are out there, can get irritating to the ear. So this mask allows you to put it on, keep it in place, and hopefully not have to touch it.
This is actually the style that I turned out that I loved. And when I was doing this style mask, air comes in and out of the side of your face. And members of my family are asthmatic. My mom has a heart condition. My dad has high blood pressure. We have diabetes in the family. We've got many, many medical conditions, and I'm trying to protect people.
I learned is that some clinics weren't accepting them because they didn't have like a bendy, flexible wire thing that you can use to fit it around your nose so that there's less open space. So there's a whole debate online about what you can put in there to make it. So like those pipe cleaners, or just like any kind of really thin wire. One thing that is ideal is the little twisty ties that you get at the supermarket, the produce section. But I found somebody had a good tip about finding it in gardening departments. So I bought this. I have enough for many, many masks now.
It's not ideal for healthcare workers to wear this type of mask because the fabric doesn't provide the protection. That there are 4 different levels of masks that we can wear in healthcare: level 1, level 2, level 3, and then you have the N95, which is the most sought after right now. But a cloth mask would be better than no mask. None of this is going to actually likely to protect you from the virus itself, but it keeps you, if you were to sneeze or cough, if you are infected and don't know it, to keep you from spreading your germs. So, it helps hold stuff in.
So far, I've made several different styles. It's a cat mask that it has calico on the back. I have another one that has a stripe that looks kind of like a wood grain and has a Japanese lantern pattern on the back. And then my neighbor said her son wanted things that were more boring, which is really hard.
I had just been using a lot of old flannel sheets and some old shower curtains. They're not that old. I just had used them to make a curtain, so I had leftovers. I've been using that, and then I switched to using flannel inside, and this was still all my sheets. And then the flannel is really hard to get my machine to go through. My machine is so old that it won't go through a lot of thick material. So that's part of the reason I bought some just, cotton today, because it'd be easier to sew on.
I've also been shipping elastic. Thursday when I sent out the masks, I also sent out 30 yards, a little over 30 yards of my elastic supplied to 3 different women, 2 in my quilt circle and my cousin's fiance, because she's been making masks, and she's been having to use the t-shirt material and the ties. And my cousin hates the ties. He's a truck driver, and when he's trying to real quick jump out of the truck to talk to his people, having to real quick tie that and making sure it's right and it's right. So I told him, I'm sending her elastic. Just tell her to remake it.
This is the sewing station, and I have my little cart here. I have my next layer of, or next round of items lined up. And then over here on the bed, I have my orders that I'm laying out to wrap up and package. And I have then ones that here on the table that need to be allocated to the orders that I haven't filled yet.
I send every box that leaves out of here for a nonprofit with a little note and with a little prayer and with a little song or a little Bible verse, you know. And the Bible verse that I've been using most of the time has been Romans 8:28.
I wasn't going to charge for the masks that I'm making, but I've had people offer to pay me. And the only way I could wrestle with accepting money from people is I'm going to donate all the money to the family house in Chapel Hill. It's an inexpensive way to be able to stay and be near somebody who's in the hospital.
I have a lot of fabrics that I've just been repurposing to make these masks. And I always, since I am a professional, dressmaker, I do have, I have supplies here so that every time I need a piece of elastic, I don't have to go out to the store. So I had those kinds of materials here as well.
This supply of fabric, I'm just going to reach back and grab a handful of it and lift it up, doesn't even begin to put a dent in the fabric that I have. I have 18-gallon bins of fabric in my basement that my family is like, why?
The mask making is a really welcome activity, I think, for those of us who can spend some time doing it, because we feel a little less guilty about having a stash of fabric, and we can make something really useful out of them.
We kind of like buy fabric and swap fabric and just have fabric. I've had fabric willed to me when people pass on their kids will say, well, Cynthia, they got plenty of fabric here in the house. You want to come by and pick it up? Sure. Everything I've used so far is stuff I have in the house. Fabric I have in the house. Threads I have in the house. I mean, literally, if I wasn't working and all I did was make masks, I could make masks for a year and still have plenty of fabric.